Hi, my name is Dr. Anna Wooten, and I'm a board-certified plastic surgeon. Today, we're going to talk about implant exchange. I often see several consults a day for this particular procedure. First and foremost, an important piece of information is that breast implants are safe, well-studied medical devices that are not designed to last a lifetime. The majority of my patients choose silicone implants for being soft, less likely to ripple under the skin, and more likely to feel like a real breast. On the other hand, saline implants are a silicone shell that is filled with sterile water and salt. Saline implants may feel and look less natural, but the benefit is that saline implants only need to be replaced in case of a rupture or if there is something that you don't like aesthetically about them, like a visible ripple that you see right here. We sometimes call saline ruptures a flat tire, which can happen overnight or gradually, and since it's water, there is no health risk to it. We would ideally like to replace saline implants sooner rather than later because after deflation, there is a possibility of concentric scar tissue growth, which can make surgery and your recovery more complex and more uncomfortable. So, call our office ASAP if you get a flat tire. Now, for the silicone implants, my recommendation for years has been to replace them every 10 to 15 years. In 2021, FDA came out with a recommendation that women with silicone breast implants should undergo regular screening with an ultrasound or MRI to check for ruptures, especially after 5 to 6 years post-implantation and every 2-3 years after that. MRI is a gold standard for diagnosis of rupture. If you're experiencing pain or hardening of your breast, or the implants are just getting up in their age, scheduling an MRI is the next reasonable step. Meanwhile, if you're not in pain and there is no hardening or tightness of the breast, come in and get an ultrasound in our office at no cost as a first step to evaluate integrity of your implants. Then you may ask, why not a mammogram? Mammograms are usually performed to check for breast tissue issues like breast cancer, but very often implant issues get overlooked and they're not assessed in depth. Why do I suggest to come back before 10 years are up? This is because after 10 years, the rate of silicone implant rupture is increasing. They're like tires on the car. They need to be swapped after a certain number of miles. If we find a rupture and will replace those implants prior to 10 years, you will get a bonus of free implants and additional check from the implant company as a warranty coverage. Next question, how can I tell if I have a rupture? Sometimes you can, but sometimes you cannot. Sometimes patients experience pain in the breast and breast feels harder, but sometimes there is no symptoms and the rupture can stay silent for years. Another common question is, if there is a free silicone, is it harmful to my health? The new generation of silicone gel implants are more polymerized or cross-linked, or in other words, they're less likely to migrate throughout the body. But with time, our body can build up a thicker scar tissue around them, which may become hard and painful over time, which is called capsular contracture. This is a long-term effect of an implant rupture. I want my patients to replace implants before those symptoms occur, because the surgery to correct the hardening is much more involving and the recovery is much longer and more uncomfortable. This is why at Balesa Plastic Surgery, we ultrasound implants in the office to detect rupture and assess implant integrity. So, check your implant card for the date of your surgery and come in for an ultrasound. Getting more into the surgery side of replacement. If both implants are still soft, the procedure is very simple, drive-through swap, what I call it. I will simply remove the old implants and place the new one, close the incision and send you home. The recovery is really minimal. If there is a hardening, which is called capsular contracture, the procedure is becoming much more involved. First, I would remove the hard scar tissue around the implant. And to prevent rehardening in the future, I prefer to wrap the new implant that I would place in absorbable mesh, which becomes patient's own scar tissue at 1 year. We typically place a drain to prevent fluid buildup or a seroma within the breast, and drain usually gets removed at 1 week post-op. Given that the healing tissue is very vascular or it has a very good blood supply, it is very important to wear compression and avoid lifting and repetitive motion for about 6 weeks. And again, it's important to replace silicone implants prophylactically prior to capsular contracture to ensure the easiest recovery for years to come. If you're interested in this procedure, call our office at 724-759-7777 or visit our website at belessaplasticsurgery.com. Have a great day.